Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having these headaches for the past 6 months, and they're really affecting my daily life. I've tried over-the-counter painkillers, but they don't seem to help much.
I see. Thank you for coming in. Your primary care physician mentioned the headaches in their referral letter, but can you describe them in your own words? How would you characterize the pain?
It's like a throbbing pain. Usually starts at the temples, and then it feels like it's spreading across my entire head. The pain can be intense and lasts for several hours.
Does anything trigger these headaches? Do they happen more at certain times of the day?
Not really. They seem pretty random. I haven't been able to pin down a trigger or specific time of day.
Have you noticed any other symptoms accompanying the headaches? Any vision changes? Nausea or sensitivity to light or sound?
Yes, I sometimes feel nauseous, and I do notice that bright lights or loud noises make the headaches worse.
Are there any instances where you've lost your balance or experienced a sense of dizziness along with these headaches?
No, I can't say I've experienced dizziness, but sometimes the pain is so severe that I have to lie down for a while.
All right, are you currently on any medications, or have you recently started taking any new drugs or supplements?
I'm not on any regular medication. I tried taking ibuprofen for the headaches, but it didn't help much.
Good to know. Have you ever had any imaging tests like a CT scan or MRI for this issue?
No, I haven't. My primary care doctor just referred me here after the painkillers didn't help.
How's your general health otherwise? Any chronic illnesses or major surgeries?
I'm generally healthy, but I do have mild asthma. I have an inhaler, but rarely need to use it.
What about your family's medical history? Any history of headaches or neurological conditions?
My mother suffers from migraines, but as far as I know, no one else in my family has any history of headaches or neurological issues.
Considering your symptoms and family history, it might be beneficial to rule out any underlying conditions. I'd like to send you for some imaging tests and blood work.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. Can you please state your name and date of birth for me?
John Smith, April 23rd, 1985.
Thank you, John. It's a safety check to confirm we have the right patient. My name is Emily, and I'll be your nurse for today. Can you tell me why you're here at our clinic?
I noticed a rash on my arm, and I've been feeling really fatigued lately. The rash looks like a red circle.
A red circle, you say? That's definitely something we want to check out. Have you been in wooded or grassy areas recently?
Yes, I went hiking last weekend.
I see. Any fever, chills, or headaches?
No, just really tired.
Are you currently taking any medications?
Just some over-the-counter antihistamines for the rash. They don't seem to be helping much.
All right, let's take your vitals before the doctor comes in. Is that all right?
Sure.
First, I'm going to check your temperature. Please place this under your tongue.
All right.
Good. Your temperature is 36.8 degrees centigrade, which is normal. Now, I'll measure your blood pressure.
Go ahead.
Thank you. Your blood pressure is 120/75, which is in the normal range. Next, I'll check your pulse.
Okay.
Your pulse is 72 beats per minute. All vital signs seem to be within normal ranges. I'm now going to take a closer look at that rash. May I?
Sure, go ahead.
Thank you. I do see the red circular rash you mentioned. It's important for the doctor to evaluate this. I'll note it down and inform her. She should be in shortly.
Thanks.
The doctor confirmed that it might be Lyme disease based on your symptoms and the rash. She's prescribed you a course of antibiotics, and you'll need to complete the entire prescription even if you start feeling better. We'll also schedule a follow-up appointment in 2 weeks to assess your progress.
Got it. Thanks for helping me out.
Of course. Make sure you schedule the follow-up appointment on your way out. The doctor also mentioned that it's essential to be cautious while in wooded or grassy areas, to wear insect repellent, and perform tick checks to prevent Lyme disease in the future.
Will do. Thank you.
You're welcome, John. Take care, and see you at the follow-up.
Will do. Goodbye.
Goodbye.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Dr. Smith, the polysomnography reports for Mr. Johnson just came in. It says that he has an AHI of 28, indicating moderate sleep apnea. What do you make of it?
An AHI of 28 definitely suggests moderate sleep apnea. With that AHI, he's at an elevated risk for cardiovascular issues, not to mention the negative impact on his daily life.
Right. And considering his BMI is 32 and he has a history of snoring, it does make sense. Should we consider recommending a CPAP machine?
I think that's a reasonable first step. But it's also important to discuss lifestyle changes like weight loss, as that can have a significant impact on sleep apnea severity.
Absolutely. Weight loss could potentially treat the underlying issue rather than just the symptoms. It will be interesting to see how he responds to the intervention.
Agreed. And because comorbidities like hypertension could be a concern, we should also monitor those closely.
Very well. I'll arrange for a follow-up and consultation about treatment options.
Now look at question 26.
Managing diabetes patients is a challenge we frequently encounter in primary care. Since we often have long-standing relationships with our patients, it gives us an advantage in managing their treatment effectively. Today, we're discussing the ABC approach: A1C, blood pressure, and cholesterol management.
Yes, the ABCs are key factors for reducing the risk of complications in diabetes patients. It's not just about blood sugar. It's a multifactorial approach.
Exactly. The first step is to assess. Take into account their current A1C levels, blood pressure, cholesterol, medication regimen, and lifestyle choices. Have they been adhering to their medication? Are they exercising?
Certainly, understanding their current status provides a foundation for any changes or interventions. The next step would be balance, which is about achieving a fine-tuning of medication and lifestyle changes. This could involve adding a new medication or changing dosages, always in a shared decision-making context.
Right. Patient involvement is crucial. Finally, the checkup. This is when we review the outcomes of the interventions. Have A1C levels improved? Is blood pressure under control? If the results are not as expected, we need to rethink our approach.
Absolutely. Continuous monitoring and adjustment are key, and throughout this process, we should provide ongoing education to empower patients to take control of their diabetes.
Well said. Education and empowerment are as essential as medication in managing diabetes effectively.
Now look at question 27.
So, Mr. Williams, you're scheduled for a laparoscopic gallbladder removal due to your recurring gallstones.
Yes, that's correct. The pain has been unbearable lately, and I want to resolve this issue for good.
Understandable. What questions do you have about the surgery?
Well, I've heard that you can live without a gallbladder, but how does this affect digestion and diet post-surgery?
Great question. Most people adapt well without a gallbladder. You may experience some temporary digestive changes, but we recommend a low-fat diet to mitigate any issues. Over time, most people return to their normal diet.
Good to know. How soon can I get back to work after the surgery?
Generally, people return to normal activities within a week or so, but it's advisable to avoid strenuous physical activity for a few weeks.
That clears up my concerns. Thank you.
Now look at question 28.
Doctor, the patient in room 12 is being treated for a urinary tract infection and is prescribed antibiotics. However, I noticed he didn't disclose that he's also taking herbal supplements for prostate health.
Did he mention which herbal supplements specifically?
Yes, he's taking saw palmetto, and he's been on it for a few months. He didn't think it was relevant to mention since it's not a prescription medication.
I see. That could potentially interact with the antibiotics or affect his liver function tests. Did he say why he is taking the saw palmetto?
He said it was to improve his urinary flow and prostate health. He got the idea from a friend and decided to try it without consulting us.
All right. This is something we need to address right away. Herbal supplements can interact with medications, and in his case, it's important to monitor for any adverse effects, especially on liver and kidney function.
Absolutely. I'll make sure to document this new information and remove the supplement until further notice.
Please do, and thank you for bringing it to my attention. I'll also have a talk with him about the importance of disclosing all medications and supplements, prescribed or otherwise.
Will do, Doctor.
Now look at question 29.
Hello, doctor. I'm calling about Mrs. Davis, the patient you referred for cardiac consultation. I had a chance to review her case and had some questions.
Yes, the patient with intermittent chest pain and high risk factors for coronary artery disease.
Correct. I see she has a family history of heart disease and has been treated for hypertension. Do we have any details about her previous stress tests or angiograms, if any were done?
I recently took over her care and do not have that information readily available. However, I can dig into her past medical records.
Could you possibly speak with the GP who referred her initially? That would help me get a clearer picture.
Her previous GP moved out of state, but I could attempt to contact him and find out more about her past evaluations.
That would be very helpful. Thank you.
Now look at question 30.
I just got out of the quarterly meeting about infection control protocols.
How did it go? I have mine next week, and I'm concerned about the increase in nosocomial infections. It could lead to budget constraints on essential supplies.
Well, they did bring that up, but more so focused on the increased use of broad-spectrum antibiotics. It seems we may be contributing to antibiotic resistance.
Ah, that's something I hadn't considered. I've been more concerned about staffing levels and making sure we're adequately staffed to maintain infection control protocols.
Exactly. We're juggling so many balls at once, staffing, patient care, administrative tasks, that sometimes it feels like we're running in circles.
Indeed. It's not just about direct patient care anymore. It's balancing that with administrative responsibilities and budget considerations. It keeps getting more complex.
It does. But that's why we're here, to make sure everything runs as smoothly as possible while still providing the best patient care we can.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good morning. My name is Dr. Alex Johnson, and today I'd like to share some insights from a pilot project we recently concluded, focusing on gout management and prevention. The aim of our project was to investigate whether individuals at high risk of developing gout are receiving appropriate preventative care and education, as well as to evaluate the effectiveness of our targeted intervention. Allow me to walk you through what we did, the findings, and the lessons learned. Gout is a painful form of inflammatory arthritis characterized by the deposition of uric acid crystals in joints. It's often perceived as a disease affecting older men, but we mustn't overlook its prevalence in other demographic groups, including women, particularly postmenopausal women. Our project zeroed in on communities with a high prevalence of risk factors for gout, such as obesity, hypertension, and metabolic syndrome. We partnered with local community centers and general practice clinics in 12 different sites to run a mobile clinic for gout screening and education. At each location, a team comprising a rheumatologist, a nurse specializing in arthritis care, and a dietitian conducted screenings, collected data, and offered consultations. Over the span of the project, we screened a total of 460 individuals and identified 72 new cases of elevated uric acid levels, putting these individuals at higher risk for gout. Here's where it gets interesting. We found a significant knowledge gap when it came to gout prevention. Many individuals were not aware that lifestyle changes could significantly reduce their gout risk. Moreover, cultural factors and language barriers contributed to misinformation about the disease and its management. For instance, some participants had cultural dietary practices rich in purines, which can exacerbate gout symptoms, yet they were unaware of this connection. Regarding lessons learned, let's talk about 3 key takeaways. 1. Existing healthcare structures. We initially included 3 senior residential facilities in our project. However, we soon discovered that these facilities already had established systems for managing chronic conditions, including gout. Our intervention risked creating redundancy and potential confusion. 2. Timing of interventions. The efficacy of preventative measures, including dietary changes and medication, varies over time. Early detection is critical, but so is the timing of subsequent interventions. We found that an integrated approach involving primary care physicians and specialists, following up at regular intervals, produced the best outcomes. Broadening the scope. Similar to your experience with flu vaccinations, there was a demand for education and screening for other related conditions, such as kidney stones and osteoarthritis. In sites where family units participated, questions arose about genetic predispositions and preventative measures that could benefit the whole family. Finally, what this project has illuminated is that there's an immense value in targeted interventions, even in high-income settings with universal healthcare access. Bringing specialized care and education to the communities that need them most can fill the gaps left by the general healthcare system. There's an opportunity here to improve gout outcomes on a large scale, and we're optimistic about the potential for future projects along these lines. Thank you for your attention, and I look forward to any questions you may have.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Lice infestations are an interesting and often misunderstood subject. Though they don't pose a direct health threat like some parasites, lice are nonetheless a topic that tends to incite strong feelings of discomfort and even stigma. Much like seasonal affective disorder has its research focusing on light therapy, lice infestations are the subject of numerous studies, primarily centered around how best to eliminate them and prevent recurrence. First, a bit of background on the critters themselves. Lice are ectoparasites, meaning they live on the outside of the host body. There are different types of lice that afflict humans: head lice, body lice, and pubic lice. These are not to be confused with other parasites, like bed bugs or fleas. Lice are highly specialized and tend to stick to one host species. Head lice, for instance, are adapted to cling to human hair and feed off small amounts of blood from the scalp. The life cycle of lice is fairly rapid, which can make infestations challenging to control. Female lice lay eggs, known as nits, at the base of hair strands. These nits hatch into nymphs, which grow into adult lice within about 10 days. The entire life cycle, from egg to adult, can be as short as 3 weeks, allowing for rapid population growth under the right conditions. Now let's talk about symptoms and detection. The most commonly reported symptom of a lice infestation is itching, caused by an allergic reaction to lice bites. In some cases, especially in people who have never been infested before, it can take up to 6 weeks for this itching to develop. Infestations are most commonly discovered through close visual inspection of the hair and scalp, sometimes requiring the use of a specialized lice comb. While they don't transmit diseases, secondary bacterial infections can occur from excessive scratching. Children between the ages of 3 and 11 are the most commonly affected group, which is not surprising given the close contact in settings like schools and daycares. However, it's a misconception that lice infestations are primarily the result of poor hygiene. In fact, lice seem to prefer clean hair, as it's easier for them to navigate and lay eggs. The treatment options for lice are quite varied, ranging from over-the-counter pediculicides to prescription medications. Some people even swear by home remedies like mayonnaise or tea tree oil, although these are less supported by scientific evidence. We have conducted a study involving 100 subjects, comparing the efficacy of a new plant-based treatment to traditional over-the-counter solutions. The subjects were split into 2 groups, and the preliminary data suggests that both treatments were largely effective, although the plant-based treatment had fewer side effects such as skin irritation. Another interesting avenue we are exploring is the resistance patterns of lice. There is some evidence to suggest that lice are becoming more resistant to traditional treatments, which presents an ongoing challenge for healthcare providers. We plan to further this research next semester by looking into the role of schools and communal living spaces in the spread of lice. By comparing children who have been subjected to traditional lice prevention methods with those educated in updated prevention techniques, we hope to see a significant difference in infestation rates. In conclusion, while lice infestations may not pose a serious health risk, they are a source of considerable discomfort and societal stigma. Further research is necessary to develop more effective treatments, particularly as lice continue to evolve resistance to current methods.